joining us today. My name is Venita Ray. My pronouns are she, her, and ella. And we do send Channyn, well wishes where she's at. We hate she can't be here, but we definitely want to acknowledge her in the room. Before we get started to this incredible panel of Black women, we want to do a few moments to introduce them. I don't want to overshadow who these women are. And so if you all could just give us a brief introduction and then I'll get started. I could have did that with a question, but why not? Take your moment.
I'll jump right in. Good afternoon, everyone. I was here to say good morning. Thank you all so much for sharing space with us today. My name is Zahara Bassett. I am President and CEO of Life is Work, a Black and Brown trans-led social service organization based right here on the west side of Chicago.
It is. Thank you, Zahara. Did I say that right?
Yes.
Okay, go ahead, Ed.
Good afternoon, everyone. Evany Turk, she, her pronouns. I am the president and CEO of Heartworks Consulting Firm, and I am the director of residential housing for Chicago House and Social Service Agency. I am so happy to be here with you all today and looking forward to the conversation.
Thank you, Ev. Cynthia, Miss Cynthia.
Good morning, everyone. Cynthia Tucker from AFC. I go by she, her, and hers.
Okay, thank you. I didn't give introductions for myself because I'm not sure who I work for, where I'm at, but I was diagnosed with HIV 20 years ago, so I'm entering this space as a woman living with HIV, so it will color my remarks, so you should know that. But I lived a whole long time before I got HIV, so I have both perspectives. I've been working in this movement for a few years now, and my last position was as co-executive director with the Positive Women's Network, which is the genesis for Celebrating Honor Black Women. And we are not the flavor of the month. We exist all the time, every day, every year. And Evany is going to tell us a little bit about what CHBW, or Celebrating Honor Black Women, means. We'd love for your questions or comments to go into the chat while we're talking. Evany, take it away.
Thank you, Venita. So I am honored to that I was asked to even join this panel because I was one of the few PWN staff members that helped to create the Celebrate and Honor Black Women movement within HIV. And we decided to do this because we were, this was during a time, COVID was happening. We had a volatile political climate, and we seen Black women living with HIV, Black women who work in the HIV field, working hard to keep people afloat, to keep people's spirits up, to support people when their spirits were down, support people all around. So we were like, what is missing? What can we do to uplift a conversation around the contributions that Black women give to this movement? And since we, are never really uplifted in that way. So we decided that, we wanted to, there were so many Black women who had expertise and had contributed. We wanted to make sure that organizations were acknowledging that. We wanted to make sure our organization acknowledged that, and that we acknowledge that in the HIV movement. We know outside of the Black gay men and trans and Black women are highly impacted by HIV. So, and they are the ones that are working in communities to make sure work is getting done. So we wanted organizations to honor the expertise and contributions of them working and volunteering for their organization. We wanted to make sure that we were saying you should be giving these Black women equitable pay them for their time, pay them for what they're doing. Make sure you are creating safe spaces, you know, within your organizations for Black women to have conversations about what they need, how they're doing, and safe spaces for them to be able to say how they're being treated. We wanted to be able to make sure they were able to show up as their full selves, because we know Black women are brilliant, and if they are listened to, then a lot of times things will change. So we wanted to make sure that the community was supporting Black women, Black-led organizations, to make sure those organizations and those women-led organizations, Black women-led organizations, was getting the support that they need, because again, we all know that a lot of us are doing the hands-on work, the work in the field, the work that is changing lives out here. So we, you know, created Celebrate and Honor Black Women, and we started doing activities and asking other organizations to do activities to celebrate and honor the Black women in their spaces. And we created these hashtags that, and a few of them I've said: listen to Black women, make sure there's space, safe space for them to be heard, pay Black women. We at PWN decided, you know, anytime we ask a Black woman, anytime we ask any person living with HIV specifically to do anything, we won't ask them to do any labor, any emotional labor for free. We're gonna pay people when we're asking them to work for us in any type of way. Respect Black women, protect Black women, and honor Black women. We wanted to do all of those things, and I'm proud that it actually took hold in the community, and that organizations listened, organizations took action, and I want to thank AIDS Foundation of Chicago for listening and taking action. So
thank you, Evany.
You're welcome.
Yeah, and yeah, AFC, thank you for doing this and being a partner in this. And I want to say, we wanted Breonna Taylor or all of our trans sisters that we were seeing dying in 2020 and since then we want their name up there too. We were, you know, we don't have nothing against our men, but our women we needed to include in this. So thank y'all for being here. So first question, thank y'all. Celebrate and Honor Black Women is August 18th of every year. Pass it on. You will hear more. We'd love to see you do more all year. So can we start? I'm gonna start with you, Miss Cynthia, if you could talk. How did you get into this work? Tell folks a little bit, and how is it going? Is it working well, or what? Just if you're
Hi, Venita. Thank you. I got into this work. I started off about 30 years ago, and I was working at Planned Parenthood Chicago. And met several women who were recently diagnosed. And we didn't have a lot of services and information. And so I went to the board and requested that we started at Planned Parenthood doing a lot more work, making sure that we were able to provide the services that were needed, that were coming from the community. And at that time, I was working in Inglewood on the south side of Chicago. And from there, I went to the Chicago Women's AIDS Project. And after that, of course, AIDS Foundation Chicago. I think what's really working is that we've moved the needle a little bit for Black women, but we still have a long ways to go to make sure that, as Evany has said, that we're honoring Black women, that we're listening to them, and that we are really achieving health equity. There are so many differences between the services that are offered, treatments that are offered between men and women, and stigma still remains one of the highest things for women.
Cynthia, before I move on, thank you for that. You mentioned that you were moving the needle a little. Can you tell us what that means? What's working? What's moved?
Well, of course, we know that our biomedical options are very different and are available, and we have people that are living longer. But in addition to that, I think we're seeing a lot more women leaders. Look at this panel and who is on it. You all are all accomplished leaders and making sure that we're moving in various communities that we are keeping at the forefront what is needed by Black women, that we are really requesting more funding, more advocacy, that there are better supports that are specific to Black women and that are gender specific, and especially for our trans women. It is really important. A lot of individuals have been overlooked and for a long time. And so it's time for us to start moving that part. And so that is happening.
Okay.
We have a lot, but we also have a lot at stake where things are, it seems like every time we move forward, things are starting to be cut. And we've seen a lot of programs and funding for Black women initiatives. And at the same time, we know that those are up for grabs coming at the end of this month.
Ooh, you said a lot there, and I'm gonna leave it alone until I kind of introduce myself. But Zahara, if I said your name right, tell us how you got into this work and what's working and what's not. And y'all, I'm pretty critical, so don't, if you're not a government employee or you're not trying to please your staff, let's get real here in terms of,
okay.
Tell me, they want me to celebrate that we've dropped 2 percentage points in our prevalence of the epidemic, but yet we still represent 60%. I'm not clapping. I'm not going to celebrate that. So I'm going to be honest with you, as a woman living with HIV, I'm just not. So Zahara, tell us about how you got into this and what's working or not working. What's going on?
Thank you so much again. Well, I got into the work from my lived experience, to be honest with you, as a former sex worker for 10 years of my adult life. I got into the work of just seeing my friends pass away, and I was nervous, to be honest with you. I just wanted to change for myself, and I wanted to help in whatever way I could help. And I started working at Chicago House under the Trans Life Care Program in 2007, and transitioned from there to go over to youth services work because I was always passionate about helping people that came after me. And what I can, give from my experience. I've always felt as a trans woman that I would be remiss of not helping someone that coming after me to show them the way of like, this is, it's other ways that you can do it. So worked at Chicago House, transitioned over to Broadway Youth Center, and I worked over with Howard Brown for 5.5 years and got into research and fell in love with PrEP research back in 2016. And went from there to morphing to working as a development director to opening Life is Work in 2017 we incorporated, but it's 2020 we opened our doors. And it's been history from there, if I may be honest. But if I tell you what changed as far as and pushing the needle, what's changed is that they have allowed people like myself a seat at the table. As I sit amongst you women and being invited into this space, they have allowed me, I would say allowed, because we were not welcome in spaces like this to have conversation with women, although we felt as women. So the needle is pushing because now we have visibility. We can speak for our community as titled as a Black trans woman, and feel okay with that, So that has changed. Is it more that needs to be done? Definitely more needs to be done. More housing, more jobs. Those things need to be done to celebrate Black trans women. We cannot continue to perpetuate that you have to be positive to get housing. We have to get up out of that and introduce a nuance of just, housing should be an equitable option for everyone in order to get their, if you say talk fairly, get their shit together. It has to be. And we have to move into that narrative of understanding that housing should be for anyone that is potentially a high risk of living out here bearing. I'm 39 years old and I'm happy to say that I'm HIV negative. But how am I HIV negative? I don't know, because I took many risks. I took many, many risks just to survive and to be in this space. with you all in celebrating Black women and being able to call myself as a Black woman of trans experience. So I'll leave it there because I'll talk all day.
Oh, we're going to bring you back because I had a follow-up, but I think you answered it. Thank you so much. I'm so glad you're here. Evany, tell us how you got into this work and what's working or what's not working.
So I got into this work because I was diagnosed with HIV 21 years ago in August. These years just keep flying by. And I stumbled into the work because of my housing provider, who was Chicago House at the time. So I want to say 17 years ago, I think it was, Chicago House actually hired me to run a medication adherence program. And that's what started me in the HIV work. And I have been fortunate enough to work in prevention, to work in housing, to work in national and local advocacy. And I think working on a national level in the policy space opened up my eyes to a lot of things that we had to continue to fight for. So I would say what's going well is there are a number of Black women leaders. There are a number of women leaders who are living with HIV thanks to organizations like PWN, thanks to organizations like the Well Project, thanks to local organizations that provided space and leadership opportunities for women. I think we fought really hard to get community grants. I think that's like, we have more community grants for people in community to do work that they know needs to be done. We are now, doing civic engagement work in the HIV space, which I think is really important. So I think those things are going well. And things that I think can be improved is still, I think we are still fighting for our space at tables.
Yeah.
And I think that's unfortunate because since I started in this work, I think I don't know if it was 2 weeks ago, I had to stand up in a room and say, but what about Black women? Why am I still saying that in the HIV space? So that's not going well. I think after COVID, our healthcare, the care that we're getting at our doctor's offices, I think it reverted back to, like, it's not as good as it was before COVID, which is a horrible thing to me. Because we know what works. I think I always say in every space I'm in, if I'm talking about policies or what works in this ending the HIV epidemic, I always say we know how to end the HIV epidemic. We just don't have the political will to do it. And it's the same with this healthcare. Like, we know what kind of healthcare people need. We know exactly what people need to get, but we have to have the will to do it. So although there are things going well, we still have to fight, we still have to push, we still have to advocate. And I'm sad about that because we shouldn't still have to do that. I'll let you go, Venita, because I know, and yeah, I know you have your thoughts, so go ahead.
No, thank you. But all of them are valid. And what I love about this panel, folks think, just because we may be living with HIV or Black women, we don't all have the same experience or perspective or analysis around this. So for me, I got into this work as a response to the diagnosis. I was diagnosed in 2003. And it totally messed me up. Even though I'd worked in HIV, I'd had friends who died from HIV. I've been an outreach worker. I had just become a practicing attorney in DC and was diagnosed with HIV. And even though, I knew it wasn't a death sentence, everybody was talking this stuff, and I had talked it too. When it became me, it looked a little bit different. And I feel that way whenever somebody's telling me, oh, it's not that bad. I'm like, what's your status? Because it's easier to say that to people when you're negative. But for me, I went into a 4-year depression of not wanting to accept it or live with the stigma of living with HIV. And I stopped. I have been doing advocacy and working in communities for years. And it took me a number of years to, first of all, want to live with HIV and getting some help and not being suicidal. But then secondly, then I found myself in an advocacy training, and it sparked the old interest of what I worked in communities for years before my diagnosis. And now since then, it's helped me heal and other things I did, like yoga and those other things. So trust me, advocacy is not where you just heal without the rest. And I've found a way to bring all of my skills, passion, and experience to the work. So for me, it was a logical step. I didn't need more in my story since I'm a recovering drug addict and a whole bunch of other things, a teenage mom, but I didn't need more, but it is there. So now what do I do? And getting into this work, it gave me a chance to do that. What has working well for me, when I first got into it, I was just kind of listening a lot and mimicking what others said sometimes in terms of, what the reason for the epidemic. And what started bothering me, I led in 2016 an effort to end the epidemic in the city of Houston, and I wrote our first citywide epidemic plan. In the middle of that plan, it dawned on me that just testing, treatment, and education was not going to get us out of this. I don't care, we can talk about that another time, but you will test, treat, and educate. We cannot or prep our way out of this epidemic. And that nobody was talking about, to me, why are Black women most impacted? Whenever I'd ask that question, I'm on the Rhine-Wide Planning Council, Black data goes up there, and then they go to the next thing of solutions. Nobody talked about the why. So living with HIV was so stigmatizing because everywhere who are allies, they didn't realize how stigmatizing they were by only showing data without the story. And so I began to ask the question. And in 2016, I created my own presentation of why Black women are most impacted. And we don't talk about the truth, which is those social, structural kinds of systemic barriers that Black women live at the intersection of race and gender, unlike any other group. And because of that, and we won't talk about that, those are the real reasons. It's not the down low, brother, we can't take ourselves. All those systemic issues that cause our viral load to be higher in my neighborhood in the first place. We didn't create that. It ain't just Black condomless sex. And I wasn't hearing that talked about in other places. So for me, what I've done is develop a racial justice analysis around this that really says HIV is a racial justice issue. And to me, that's the way we need to be dealing with this. You can't look at any disparity and look at all the Black folks and then think it's a behavior issue. That is stigmatizing. It supports and continues this white supremacy structure that we have that's caused the racism, the discrimination, the anti-trans, dribble. So for me, what's working now is having people talk about, I'm a more of a policy and a structural change person. So having people, and we're doing more talking about, some of those structural barriers and issues. We're not doing enough, but at least, some folks have started talking about more than just behavior and condomless sex. And let's be real, HIV was never dealt with in the way that it should have been. So the housing for people living with HIV was designed for people who were dying, because back in those days they were dying. It wasn't meant as a long-term solution. So trust me, there ain't enough housing for people living with HIV, never mind negative. And if we had a system that worked, if we had housing in the first place, maybe the 1.2 million of us wouldn't be doing this. But the solution for me isn't take it away from them to give to them. That's a scarcity model that's perpetuated by government. The solution is we need housing for prevention, and we can't forget the 1.2 million of us already here. So I used to perpetuate in an epidemic, but I now don't see myself in it. If you end it, I'm still here because there's not a cure. So where is the policy and the language for those of us still living with HIV? And I'm saying that the policy language, and this is one area that's not good, is shifting. to let's provide that for all, which should have been done in the first place. Now that you got us, what are you going to do with us? And we see, Congress fighting and zeroing out a budget. We're lucky to get flat funded. So I am in those issues, and I don't think our government and folks want to grapple with racism and gender inequities that are at the heart of this. And I think until we do, we're going to be doing topical approaches of PrEP and all other whatever flavor of the month that goes on. So I'm optimistic. I'm optimistic, so don't think I'm not, because I couldn't do this work if I wasn't. But HIV criminalization, which we know Illinois just, Texas too repealed it. We repealed ours in '94, but it still continues here. So Illinois is going to have to do it the same thing, but you're just not in the South. So I could go on too, and I don't want to, and I want to move on to the next question unless we've got some questions down there, because folks who know me know I can, and I'm not really shy anymore about it. So I guess I'm going to start back, and I'm going to start with you, Evany, about what are the greatest community needs as we approach this, and I'm going to put quotes, this quote, ending of the epidemic, because no one has really defined what it means. And until we tell them, they might tell us, and we'll say, I heard Harold Phillips told me one time, we were on a panel, we might end it for some and not all. And I said, well, how is that ending it? And we see the numbers for white gay men have improved, but Black folks haven't. So Evany, what are the greatest community needs as we approach this phantom end of the epidemic, or if it was real, what are those community needs? I know, y'all, I'm gonna stop tomorrow.
No, greatest community needs. I mean, there are so many community needs. Right now, I will say
the greatest, because when one of the things they play scarcity, but the reality is we can't get it all. So right. What's the greatest? Come on now.
I will say, from my perspective and what I'm working in now, the greatest community need for me in my space right now seems to be a focus on mental and behavioral health care. There has been a lot of trauma just in the world. That's not mentioned everyday life. There has been an increase in everything financially, but no increase in salaries or in support to help people live and thrive. And I'll also say that there's a need to talk about people's quality of life as well. We don't, we think it's okay for people to just support people in survival, but people living with HIV, as we said, are aging. So I believe we should be focusing and talking about, okay, what does your quality of life look like? What does a good quality of life look like for you, and how can we support you in that? So I'll leave with those two things.
Really cool. Mental health, oh my God, that's so good. And quality of life is so big. I'm so glad you mentioned that, because quality of life says we're more than our viral load. We're more than our CD4 count. So stop judging my health on that. If I don't, I might be looking at something else to determine whether I'm well or not. And so when you reduce me to two numbers, a CD4 and a viral load, you erase my total humanity and see me as a number instead of a person. So come on, Zahara, what are some of the community needs, some of your greatest community needs you see?
I would have to agree with Evany that mental health is at the top of the list. As I say jokingly to around, a kitchen table talk, is that, mental health is real. And I say, especially in the Black community. And I say that because we, as a culture, don't like to go talk to people. We feel like that's taboo to put people in our business, right? So it creates this, this phobia, this blockage that, people are not getting the help or the access to. Because I'm gonna be honest, getting on a mental health list to see a provider, honey, it is the list. The wait times are extremely long. So I tell people, I always live off my experience, and I always look at providers in that way. If you can treat me in this way, I can imagine with the person coming behind me, how they're feeling. And I'm educated enough and witty enough to know how to advocate for myself, but everyone else does not. you know. So that's why I'm here. That's why I set on the lines for people to, when those fair treatments are, when those non-fair treatments are not happening for them, that we can step in and advocate for them. But yeah, mental health. I would say mental health is definitely the approach. But then I want to also go into, Venita, what you were speaking about, housing. Yes, it needs to be more housing for everyone, right? And it's a huge issue regardless of what intersection we are pulling it from, right? It's an issue. We know it is, right? But we have to, as what you were saying, with the education piece, with the prevention piece and testing piece and all of those things, those are great things, but I always say we're doing it backwards. I cannot expect you. I always say we're doing backwards because I cannot expect you to keep your appointment. I cannot expect you to take your medication on time. I cannot expect you to do anything correctly as a functioning adult if you don't have anywhere equitable to lay your head. And that's why I always say we're doing it backwards. If we're talking about getting to zero, like we should be, right? Then why are we not looking at it in a holistic approach of equitable jobs that people are able to work, equitable pay with those jobs, right? Somewhere properly where they can lay their head at their choice, and to get up to take care of their business. You cannot think that someone can actually get up and function like a normal, regular citizen if they don't have everything that's working well for them in their lives.
Nope.
And I'll leave it there.
I was getting ready to do snaps on you on that because I think you're so right. Thank you for that. And I was putting something in there and forgot my train of thought. Come on, Cynthia. What do you see as some of the greatest needs? Because I would agree with Zahara as well.
I agree with both Evany and Zahara. I also believe that we just really need a multifaceted approach, and we need interventions that are bundled. Women have many different challenges, and to meet those challenges, we need to be able to provide social support, navigation services, making sure that they have housing, mental health. I think one of the places where we miss is really social support. It used to be a big thing and then it got all taken away. And women need that with the high amount of stigma that there is, making sure that we really are promoting inclusivity, empathy, and really understanding Black women and their needs. Making sure that we are creating inclusive spaces where they can come, that we are invited to the table to be a part of programs, and not only be a part of the programs where we are paid staff, but people with lived experience have to be at the table for every program that we have. We have to do listening sessions. We also need to make sure that we're doing healing. Many women have been traumatized, and we're forgetting that. And we're forgetting, yes, they need housing, they need mental health, they need behavioral health, they need all of these things, but social support, spiritual health, and all of those things need to be a part of our program. So it just needs to be multifaceted.
Ooh, perfect. You can't, what I'm hearing you all say, you can't approach us with only a biomedical solution that does not work for Black folks and we didn't design it. So you can't come with us a solution we didn't design. So some of my areas of greatest need, I take a little different approach, is this MIPA. And I don't know if folks know what MIPA is, meaningful involvement and it could be whatever most impacted group you're dealing with. In this case, we're talking about people living with HIV. Meaningful involvement means we need to be decision makers. How are you engaging us before decisions are made about funding, programming, and design? If we're not being hired, stop asking us to share our stories, and relive emotional trauma for a lunch. So this meaningful involvement, what is the formalized mechanism that you are constantly taking input and lessons learned from folks you're serving, and how are they involved in decision making? So MIPA, or meaningful involvement, needs to be more across the board. It's really hodgepodge, or people talk MIPA, but what they really are doing is very, very top down kind of approaches. I also think we need the policy support and the political will. When you're talking about housing and some of the other things that have been done, well, they were done because there was political will at the time to do them. What we're seeing now is a shift away. We are seeing it in the HIV community, away from people living with HIV to ending the epidemic. So we still need that political will and policies that support this collaborative approach to serving us. Right? If we don't keep, we've got to fight for that. If we don't keep the policies and systems in place to support us, we will not survive. And so somebody's got to be going up on the hill. Somebody's got to be going somewhere so that we can be talking about and building political will. And then the last thing I would talk about is this idea of stigma, stigma is not an apple. You don't bite it. It's one size. It is layered. So I use a term called intersectional stigma, which says, you can't just, if you be specific, if you're talking about HIV stigma is one thing, but if you just want to say Black women experience stigma, we're probably experiencing some racism, some patriarchy, some discrimination. It is layered and you cannot approach it in a single way. Zahara, you might experience some anti-trans stuff, Black stuff, everything, never mind if you were living with HIV. So I think we've got to be looking at the multi-layered aspect in which Black women have to show up. The historical context from which we show up in a society that doesn't value us. And then all of that puts the whole weight of our communities on our back. So when Black women heal, communities heal. When Black women do better, everybody do better. So I think we've got to have policies that support what we need. And Cynthia and Zahara, everything y'all talking about, somebody needs to be somewhere talking to decision makers about those things, because they're not going to happen just because we need them. And then we've got to deal with this and find ways to engage most impacted people and centering their experience and their voices in a humane way. So I think we got at it all. I just took this bigger approach of I deal with the structural kinds of things. But tell me, what are you all?
Totally.
Oh no, go ahead, Zahara. You want to say something, please?
No, I totally agree with you. And I wanted to quote Dr. Tatiana Moulton. She was in DC recently. At the USC CHA conference, and she had spoke on the open plenary and said that we are all HIV possible. And that has resonated with me because it's a testament to say that we are all possibly can contract HIV. So we are not ever clear of anything, and we have children. Something that I just see that we never really talk about is that we have actual children that were born in this world into a stigma that we still don't even address now today.
You saw that plenary, didn't you?
Yes, I was there. So we have kids and I'm just looking like, yes. This is the reason why women needs to be protected and upheld at all times. And the only way that we can get to this 2030 ending the epidemic, I don't even foresee it. I'm like, we ain't even got to end the homeless yet. So how we gonna end? Just had. But I just thinking about that is like only way we can move forward is that we have to look at it in a more holistic approach.
That's right.
We have to look at it in a more holistic approach. We have been doing this thing and many on this call has been doing this for way longer than me. Before I even was thought about walking into the doors or sitting at any one table. And it's not, yes, it has pushed some needles, but we have to look at it again in a different approach. And I think that is what you're saying, Venita, too, is that it needs to be talking more in policies, and not continuously moving in that turning the old wheel. Yes, it's some new things that's trickling on, but it needs to be more intentional policies put in place.
Absolutely. Thank you, Zahara. And if you'll notice, you don't see too much getting to zero. I think Arizona's EHE plan is that way, but you don't hear too much about getting to zero, because I worked a lot with a gentleman called Dr. David Holtgrave, who is the master of all of these formulas and stuff around EHE and stuff. And he will tell you, he said, Venita, all my formulas never get us to zero without a cure. So he can predict getting us down to a certain point, but still there's no zero without a cure, but we can still define ending epidemic a certain way, which like New York State did. They said they had 3,000 cases. So they said, when we get to 600, we will consider it ended in our state. So they found a way and put work to do that.
Now, I do believe that, you know, Chicago has some amazing providers here. Amazing invested providers here. And the viral load suppression levels are, you know, people are, you know, I can contest that I've sat in, you know, some meetings where I've seen that providers and clinical spaces have really high suppression loads, you know, and that's wonderful. I think that that's amazing that we're getting people to that, you know, to that point. But how do we end it? I think you're right, that we're going to need a cure. And what's taking so long, I don't understand.
I also think, and Venita, I want you to talk a little bit about status neutral and what the conversation around that has been, because I think a lot of the community is not always aware of the different sides of a story, the different sides of an intervention, the different sides of a conversation. So we've been talking a lot about, and people have implemented, and I know Chicago has, because it started status neutral years ago, but started using status neutral model, which is great, which we should, you know, look at all sides. But Venita, if you wouldn't mind talking a little bit about the status neutral conversation and how that's creating kind of a like scarcity, like taking from one, giving to another, sides that we're not all looking at.
I think Zahara kind of mentioned a little bit of this. The status neutral is about services should be available regardless of your HIV status. Now let's think about that for a minute. Isn't that the way it was supposed to always have been? You know, before there was HIV, or even since there's been an HIV, I know that the people, and so let me say this, the testament to what services are available in the service model in HIV is a testament to people living with HIV who fought, marched, died, and rolled over to do that. And others have copied the HIV service system for a while because it is one of the most, you know, well thought out due to HIV advocates over time. Folks haven't learned to do that in other places. So as advocates fought for what they needed, now we didn't stop the deaths, but we definitely slowed them down after 1996, but folks are still dying. We didn't stop them. Now our federal government, and rightly so, we should be serving all, but it doesn't mean that status neutral now means we will take, you know, things and your HIV status isn't an eligibility requirement for the services. That is all fine. But again, what we are saying is those policies now are replacing the HIV related services in a lot of cases and monies to where you still got to think about how you serve the 1.2 million of us left here. You cannot just say we're just going to change the policy and shut y'all out, get in line with the rest of them when we're already dealing with it. We don't want another person to be coming up positive, but at the same point, we don't want to be left out either. And we are still here. We're aging. When you're taking away services, now one of the suggestions has been to use the Ryan White infrastructure to deliver PrEP. Well, if we use infrastructure, we're saying that infrastructure like it doesn't mean money and people. It does. So if we use infrastructure, you've never come talk to the HIV community about impact on you. If you were seeing 4 people living with HIV, now you got to see some people to counsel about PrEP. How many people are living with HIV are you seeing? It's got to impact us, and no one has come talk to us to say, where is the money's coming from? Are ours assured over here? If theirs are assured over here? No, I think what's happened, the federal government has moved on with this. And now we're left trying to pit against each other, which is not the way it should be. We need to all be going to them saying, status neutral is fine. Do that over there. Show us where that money coming from. Now put the money back where the 1.2 million of us who are already here. And so we didn't feel like we were engaged at all in the conversation. There was no going to play. We're just looking at budget shift and policy shift. Right now, we are feeling invisible. You know, the more this comes out in which we believe PrEP for all, status neutral people should have services. But I know I was in a room in DC recently, and the more the conversation, I just felt erased in that room. And that's what sometimes these conversations, when you don't engage us so that we're all at the table to have these conversations, we end up fighting against each other when we shouldn't be. So I'll stop there. And
I agree with
I'm
you
gonna
on
ask our
that.
last question after you, Zahara, because we are.
I agree with you on that. That is definitely, put us into an awkward situation. But I'll say this though too. If we don't continue with the status neutral approach, we're gonna continue, we'll never get to zero. Let me say that. I truly believe that. We'll never get to zero. The reason why is because we have current youth out here now that is purposely putting themselves at risk to become positive in order to get housing, in order to get the services that their friends are receiving. You know what I'm saying? So we have to figure out, like you say, at some point, okay, who gets what and how do they split this budget out? And why is it, for people to not feel that they even have to go put themselves at risk in order to receive some type of equitable living, or, to receive the equitable services that the quality of care that they're seeing their people who are positive getting. Because the services are a bit different than what a person will get when they're positive. I'll just speak from my experience. Me as a non-positive person, I will get a call from a doctor in a heartbeat. I just actually did. I can show you the text message. I can get a call from a doctor saying your insurance is not going through. Please, and that's it. No follow-up, no referral over to the next place. It's just left for me to figure it out. But my counterpart, who is positive, doctor will call and they're going to tell them, we're going to figure this out for you. We'll call you right back.
So
those are the quality of services that are different, and it shouldn't be.
Yeah, totally agree with that. Totally agree. So you get no disagreement from me. So this is what you could do that we can do too. When they're talking status neutral budget, you say, okay, show us the status neutral budget and then show us the HIV services budget. Make sure that there's money for both and you're not robbing Peter to pay Paul. That's all I say. So
right.
My last question to y'all is, how can folks listening on here today or want to know, how can they go about centering Black women in these conversations? Because like I said, the federal government or states didn't ask my opinion before they changed policy without thinking of the impact and a way to do it. So what are some ways they can center Black women? Because even though USCHA, we were centered, but we went back yesterday and the Her Suspense program is still ending. I ain't seen another initiative for Black women other than what we're doing. So I don't know what y'all see, but I feel like the flavor. So how do we center Black women in this work? So come on, Cynthia, you've been quiet.
As you all are the experts.
We got a lot of experts here, lived experience,
yes.
but you have lived some experiences too. This lady said, I didn't need to be hit by a Mack truck to know it hurts. So come on with your lived experience, please.
I think that to make sure that we're centering women, that we need to bring them to the table, that they need to be, and you all have stated it earlier, they need to be a part of programs, and not when the program is funded, but as we need to bring women, Black-led organizations to the table as we are creating those programs, making sure that they are a part of it, making sure that they are paid, making sure that when we have listening sessions, focus groups, and all of that stuff that we need to do, that we are paying folks for their time and for their expertise. It is really important, and I learned this from a HRSA project that we recently did, that we have to work with women at the ground level, be a part of the programming, making sure that they are there, paying them, and making sure that they have equitable access to services. But that we found out that the navigation services and having someone with lived experience really assisted with bringing other women out of care who have fallen out of care. And I hate saying that word, but you all know what I mean, who are not in care currently. Let me say it correctly.
Who didn't go to the doctor.
Who didn't go to the doctor, correct.
They might be in care and they're not.
Exactly. I caught myself.
It's my care.
That
Water,
we are reaching out to them and saying what are their needs and bringing them to the table and making sure that they understand what the services are they're receiving and how they navigate those services, what are their barriers, and that we're countering those barriers, not just by saying it, but providing them direct solutions.
Ooh, thank you. Evany and Zahara, which one of y'all want to go? How do we center Black women. And Cynthia said we got to bring them to the table. And we've been saying that for a while. Why haven't we? Evany, how do we center Black women? Because everybody know that, but why we ain't doing it?
I don't know why we ain't doing it. What I do know is that people say things. Well, when people can ignore Black women not being at the table, they will. If you are a Black woman, living with or not, and the conversation happens, or you at any table, you should be like, where are the other ones? Because we are not, we don't all speak for each other. There should be a multitude because we are anchors in our community. We care for our community. As you said earlier, we heal our community. You heal us, you heal all. So it makes no sense ever for a Black woman to not be at the table. One of the things that I want to say in ending is what I think can help change for the better the community is to make sure that, one, of course, Black women are at the table, and more than one, and make sure they can get there. You have to make an effort for Black women because we have so much happening. So you have to understand the reasons. If they're not there, let's figure out why they're not there and remove those barriers so they can be there. But when they get there, listen to them. Don't just fake listen to them and do what you want to do once the meeting is over. You have to actually listen and see how you can implement the things that they're giving. Everybody has good, ideas and thoughts about how to make things better. And I think one of the things that we need to do in order to end the epidemic and get to zero, whatever terminology we're trying to use outside of a cure, because I told them that, like, you can't end up until I'm cured. But if we want to reduce these rates and we want to stop Black women from contracting and acquiring HIV, we need to do something different. We need to have creative, innovative programming. We need to make sure that Venita, I look at Beam. I love Beam. I've been talking behind you. I've been talking to so many people about Beam. I've even recently talked to I talked to Harold Phillips about Beam. I talked to the CEO of SAMHSA, not the CEO, but the SAMHSA lady about Beam, because I said they are doing something so different for mental and behavioral health that is something that we need to look at. And I love it because they're listening to their people. Yeah. They are not doing this by what they think should be done. They're actually listening to the community and they're implementing what the community says. So if we are doing that for Black women, if we are listening to Black women and we are implementing what they tell us to implement, then we change the world. And understand, I want to make this clear, when I say Black women, I also mean Black trans women. When we are listening to them, when we make sure they can be at the table, we change the world. I'll stop.
Go ahead, Zahara. Final word from you, sweetie.
I don't even know how to follow up on that. The only thing I can say is that I have to call on my Black women, all walks and creed of Black and brown women, right? And I have to say that we have to also hold ourselves accountable in making sure our sisters are at the table and we are not the only one. That's why I love Dr. Tucker so much, because Dr. Tucker is surrounded around Black women and making sure that those Black women are diverse in all walks of life. So I just have to say, the way we center Black women is we center ourselves and making sure when we get to that door and kick that door in, we're letting others come in with us. So that's how I would say that's the way we center ourselves even more, is that when we get to those doors and get to those tables, that we pour on one another as sisters, and we are our sister's keeper. Because in order for us to get to anywhere and gain that visibility that we need, we have to lean on one another. We have to trust in one another. We have to protect one another. We can ask others on the outside to do all of this, but we have to do it at home first. We have to do it with us first. We got to start here first. We can't ask nobody else to clean our houses unless our houses are clean together. So we have to depend on one another and understand that no, it should not just be one Black sister sitting at the executive table. It should be multiple of them sitting at the executive table or on the team as a consultant or as a facilitator. So that's what I'll leave with.
Woo. And I'm not gonna mess with that. Thank you, Zahara. Your word is the final word. I agree with you, everything. I don't know if we had any questions. I've been checking the chat and hadn't seen any. I love somebody dropped Beam in there. There's so many resources on the Beam website, and YOLO would be happy to hear from y'all if y'all want to reach out to them because they are doing big things. So I just want to say thank you to AIDS Foundation Chicago for sponsoring this space, for uplifting, celebrating, and honoring Black women. We need this every day. We're not the flavor of the month. We've been here, we're gonna be here, and we really need others to, center us. So I want to thank the panel, and I appreciate you all, and I respect time. So I'll turn it back over to you, Livy, if that's appropriate.
Yes, thank you so much. And yeah, just to echo Venita, thank you all again so much for your time and energy today. It was a wonderful conversation. We have it recorded, and so it will be available on our YouTube to share out if you would like to do so. So thank you all again, and hope you have a great rest of your day.
Bye.
Thank you.
Thank you.
Bye.
Zahara, I like you, girl.